Now, dirty water is once again turning deadly in Madhya Pradesh. Weeks after contaminated water claimed 15 lives in Indore, a fresh outbreak that has triggered an alarm. The Guillain-Barre Syndrome, GBS as it's called, is surfaced in the areas. They're killing at least 2 people, 2 children in fact. 13 new cases have been reported, prompting the WHO probe into yet another public health failure. Here's what happened.
Dirty water is wreaking havoc in Madhya Pradesh once again. Weeks after, filthy water killed 15 in Indore city, shattering all misconceptions around it being the cleanest city in India. Another outbreak has put Madhya Pradesh to shame. The deadly GBS, Guillain-Barre Syndrome, has raised its ugly head, this time in Mandsaur and Neemuch in the state. 2 children have died, raising a big scare. 13 new cases have been reported.
मैं तो पहले कुछ समझ नहीं पाया, पैर में दर्द हुआ, फिर हाथ में आया और फिर नाक और सांस पे कब्जा कर लिया उस चीज ने, ये जो भी था। नीमच जाके इस चीज का पता चला और उसके बाद में हम सीधे अहमदाबाद गए। 12 घंटे में उसका ट्रीटमेंट लागू भी हो गया, लेकिन 13 दिन उसका इलाज चला पर उसको बचा नहीं।
So what is GBS? This is a rare neurological disorder where the immune system attacks the nerves, causing muscle weakness, tingling and sometimes paralysis. The infection linked to poor sanitation.
GBS is also referred to as Guillain-Barre Syndrome. The neurological word for this disease is acute inflammatory demyelinating polyneuropathy. It's a fancy word, but what really happens in these patients is there's an acute, that means a sudden onset of the peripheral nerves, the nerves of your legs, your arms, demyelinating. So they start losing their myelin, so the nerves stop working. So the patient will usually present with paralysis. The paralysis starts off from the legs and spreads upwards. And once the disease involves the diaphragm and the respiratory muscle, the muscles which help us to breathe, the intercostal muscles, these patients will not be able to breathe on their own. So they will need ventilatory support. You'll have to put them on a ventilator. GBS has been linked to a bacteria called Campylobacter Jejuni. I want to emphasize here that GBS in neurology is treated as a neurological emergency. It can prove to be fatal. So whenever we have a patient who presents with GBS, what we usually do is we admit them to the neuro ICU. These patients will require very good intensive care. If their respiratory muscles are getting involved, you'll have to put them on a ventilator.
A clustering of GBS cases usually shows some sort of a trigger linked to sanitation, and that's the reason why this cluster is being studied deeply by a team of the World Health Organization and the Integrated Disease Surveillance Program. Now, they are going to give reasons for this outbreak, but it is indicated that it could perhaps be linked to dirty water yet again. This is another addition to Madhya Pradesh's Hall of Shame, speaking volumes, a reflection of poor governance, poor focus on public health issues, and the inability of the administration to prevent deaths and infections from these absolutely preventable causes. In New Delhi, Sneha Mordani for India Today Television.